Hello, everyone, and welcome. Thank you for joining us for this second day of UN Behavioral Science Week 2024. We're very excited to dive into the topic today of evidence that behavioral science can meet policy and programming challenges with our speaker, Professor Katy Milkman. So for those of you who haven't seen me before, my name is Mary McLennan. I am the Senior Advisor on Behavioral Science to the Executive Office of the Secretary General. I also lead an initiative called the UN Behavioral Science Group, which I will come to shortly. But before we get into the content of today's session, what I did want to do is to speak a little bit about Behavioral Science Week. So this week we bring together 38 UN entities. There's quite a lot of interest and demand when it comes to behavioral science across the UN, as evidenced by a lot of the work, which we'll speak about throughout the course of the week. Here's just the agenda to hear a little bit more about some of the topics that will be covered. So we have sessions ranging from gender to sustainability, through to strategic foresight and even health. So lots of different spaces that we'll be exploring and lots to unpack over the next few days. So we'll put those links in the chat for you to explore and to sign up to the meetings, to the sessions that will be happening throughout the week. Okay, so in terms of today's session, just a little bit on housekeeping here. So we'll be taking questions for our speaker in the Q&A box. So put your questions there. We won't be taking questions from the chat. So put them in the Q&A box. And even if you don't have a question yourself, you also have the opportunity to upvote the questions of your colleagues in the Q&A box. So check out the box, even if you don't have a question. We would like to have a discussion that relates to a lot of the thinking and of the group today, as well as that resonates with the audience. Okay. So with that, on to our speaker for today. So we're very fortunate to have with us Professor Katy Milkman, who's the James G. Dinan Professor at the Wharton School in the University of Pennsylvania. Her work focuses on the science of behavior change and behavior change for good, which is actually the name of her initiative that she leads, the Behavior Change for Good initiative, alongside Professor Angela Duckworth, who's also a figure well known in the behavioral science community. She's also recently published a book called How to Change, which is a nice background in the fundamentals when it comes to behavioral science, both within our everyday lives, but in terms of the work that we do. And then she also hosts a podcast called Choiceology, which really unpacks a lot of the principles when it comes to behavioral science and behavioral economics in ways that are easily accessible for everyone, essentially. In addition to Katy's efforts in academia and these spaces, she's also pushes the boundaries of behavioral science in her work when it comes to mega studies or large field experiments, which I think we'll hear a little bit about today. And she also has done some interesting work when it comes to habit formation, which again, I think we'll unpack a bit further. So in addition to all of this, Katy's been a really pleasure to work with and to collaborate in different webinars that we've had. She's a very clear and practical thinker when it comes to how do we take academic thinking and apply it to the real world. So very much looking forward to her remarks today. So with that, Katy, over to you.
Thank you for the lovely introduction. I'm excited to be here. I'm going to go ahead and share some slides and then we can jump right in. So today I'm going to talk about evidence that behavioral science can rise to meet policy and programming challenges. And I hope some of what I'll share will be relevant to each of you, whether in your personal lives or in your professional, but hopefully primarily in your professional capacity. Let's get my clicker working. Here we go. All right. So the first thing I want to introduce is the idea that we can think about having two types of tools anytime we want to address a policy challenge. Say there's an issue with getting people to pay taxes on time, for instance. You might think about using economic insights to try to change the tangible costs and benefits of that choice. If people aren't turning their tax forms in on time, you might say, oh, well, we'll leverage incentives. We're going to institute fines for people who are late, or perhaps we'll give people some rewards if they file early. We might ban them from having access to other resources if they haven't filed their taxes, or maybe we provide them even with new information about how important taxes are to creating a sustainable organization and government. So you can imagine all of these different economic insights for that particular problem, or for any other problem. I'm just using this one as an example, of course. Alternatively, though, and this is what I study, we can use insights from behavioral science. I'll call them behavioral insights to try to change the psychological consequences of decisions as opposed to the economic. And I don't mean that in a sort of a tortured way, right? I don't mean, making people experience anguish. I'm more talking about addressing psychological barriers that might prevent someone from taking an action that's in their own best interest and in the best interest of, say, government, or society. So reasons that people might not take a positive action, like, say, paying taxes on time, would be things like present bias, impatience, oh, why would I do that now when there's so many more interesting things I could be doing? Forgetfulness, oh, I meant to do it, but I didn't get around to it. Often the need for belonging can be a barrier to change. People don't feel that they are connected to the right social networks, and that shapes their decisions. So thinking about how we could change these psychological rather than economic forces would mean using behavioral insights to create change. And I want to give you some examples of how this can be done effectively. So first example is probably the most famous from our whole field. It's a major win and one of the most powerful tools in our toolkit for changing behavior, and that's to understand the power of defaults, or what people end up with if they don't take any action. So this is, I'm going to show you a little bit of data from a study that was run or that was conducted over 20 years ago. And this study involved looking at a company in the United States that had a 401k plan, which means a tax advantage savings plan for its employees, but it was completely optional. On the first day of work, employees decided whether or not they wanted to opt in to having a portion of every paycheck sent over to this tax advantaged savings plan. Of course, this is good for employees because it means they'll have a more secure retirement. It's a great thing to do, but they're going to have to check this box in paperwork in order to sign up. And a great behavioral insight is that it turns out if instead of having people check a box to sign up, you instead have them check a box to opt out, you see a 76% increase in enrollment by simply making it the default to enroll and saying, oh, we'll automatically sign you up unless you say you don't want that. We'll automatically start sending a portion of every paycheck to this savings plan. It has this dramatic impact on decisions. And of course, defaults have been used now in many other settings as well. They're useful for everything from encouraging vaccination to changing the likelihood that people will agree to become organ donors. Sometimes there are complexities. You need the default to target a behavior where follow through really is going to create positive change. But the research is incredibly clear on the power of this tool. Speaking of vaccinations, I wanted to share another example from my own research. This is a prior pandemic to the COVID pandemic. Back in 2009, we were all worried about H1N1 and trying to encourage people to get flu vaccines that also contained a vaccine against the H1N1 virus. And we partnered with an organization that was holding free flu shot clinics and inviting its employees to come and get a vaccine at any of the free flu shot clinics at any of the dates and times. So they provided information, they had thought about costs and taken them down to zero. They're trying to make it as accessible as possible. And we said, we think we can do a little better by actually prompting people to think clearly through the date and time when they'll get a vaccine, because one barrier to follow through is that people forget. It doesn't ever enter their calendar. They don't make a concrete plan. They can always say, oh, tomorrow, but let's get rid of that vagueness and get people to make a concrete intention, and we may see an increase in follow through. Note this is a zero cost adjustment to a standard mailing that's being sent to people, and it doesn't constitute making an appointment. People are being invited to write this down in the privacy of their own home, and the idea is they may put it on their calendar, but they're not scheduling themselves formally. What we see is that this simple change to a mailing sent to employees' homes leads to a 12% increase in vaccination. So another example of a behavioral insight win. Here's one from a recent study that I think is really important to keep in mind on the power of making goals a little bit clearer and more bite-sized. So we partnered with an organization called Crisis Text Line that provides crisis counseling to people who need it via text. And they are staffed by really an army of volunteers who are trained for 40 hours to be excellent crisis counselors. And these folks who do this training program commit to 200 hours of work for the organization per year. But of course, many don't actually meet that commitment. They receive regular reminders of their 200-hour yearly commitment, and they're encouraged to work some hours every week. And we realized that's really not a bite-sized, concrete enough goal. And we know that people find it more straightforward and approachable when they do have those really bite-sized goals. So we just adjusted the language a little bit. We said, let's not say some hours every week to meet that 200-hour yearly goal. Let's be really clear. That's actually 4 hours every week that you'd need to reach your 200-hour yearly commitment. And just that simple change in language and these biweekly reminders that we were sending led to an 8% increase in volunteering during a 12-week study period. So really simple changes in language like this can have powerful impact on even a workforce. Final example I want to share before talking a little bit more broadly about behavioral insights is that sometimes we don't just target behavioral insights, but we actually try to blend economic insights with behavioral insights. These two toolkits can be used hand in hand. In a recent project that was led by Rachel Gershon at UC Berkeley, we were interested in whether or not we could use social forces together with standard economic incentives to encourage physical activity. And I don't know if you know this, but one sort of startling statistic is that about 9% of premature mortality globally is due to inadequate physical activity. So this is actually a fairly important problem. And we know that we can pay people and they'll exercise a bit more. So in this study, we invited people to sign up with a friend, and each of them would earn $1 every time they visited the gym. That social connection might drive them to the gym more. But we tried another version of this economic incentive that was behaviorally informed, which was actually to make it a little harder to earn the dollar, which traditional economics would tell you is a bad idea if you want to promote an activity. But we said, you'll actually only earn $1 every time you visit the gym together. So some people earned $1 every time they visited the gym, and others were randomly assigned to this more constrained form of incentive. But the idea behind it was that if you can only earn $1 when you and your friend both show up at the gym within a 30-minute window, you're likely to show up together. You'll probably hold each other accountable. You know, you don't want to be the jerk who lets your friend down, and you're probably going to enjoy your workouts more because you'll have someone to talk to and spend time with at the gym. And what we found is that this tweaked the incentive that made it harder to earn $1 for exercise, actually increased gym visits by 35% over a 4-week period when we tested it, suggesting that using economic incentives alongside behavioral science insights can be really powerful. So I've given you a little taste for what behavioral insights can do here, but I just want to acknowledge that there are now hundreds of behavioral insights units operating globally, sometimes called nudge units, many in governments, but many also in private organizations. And this is really all thanks to the work of Richard Thaler and Cass Sunstein and their amazing book Nudge, published in 2008, which explained how powerful it could be to use these insights to change organizational outcomes, and particularly for governments to use them to achieve goals that would benefit society. So with this growth, though, comes a question of sort of, can we measure what is the impact? How do these interventions perform overall? And a really powerful recent meta-analysis, meaning sort of a big analysis of every behavioral insights or behavioral science tool that had been deployed in a randomized controlled trial by the behavioral insights team in North America was analyzed. And this was a really wide range of different tools tested, mostly related to messaging. So not so many defaults, because those do tend to be a bit more complex to implement, but things like texting people reminders, sending them new emails that had been optimized using behavioral science insights, sending out letters to homes, mostly communication strategies, and then A/B testing. Do the behavioral science insights embedded inside of these improve their outcomes? And I think it's really important to note that the benefits of these interventions on average were, first of all, significant and reliable, but they aren't huge. So on average, these kinds of improved messages and reminders are leading to about an 8% increase in the behaviors targeted that for an increase, or a 1.4 percentage point, 1.39 percentage point increase in absolute terms. So small, but measurable and reliable. But we do want to sort of rein in expectations and make sure, I've just shown you some of our biggest wins. Not every behavioral science intervention necessarily changes everything, but often they do have these reliable benefits. And what's more important to note, I think, about those reliable benefits is also how cost effective they are. So I think we would be doing a disservice to anyone if we said, you don't need any other tools now, get rid of your economic toolkit. Let's just use behavioral science interventions. But actually, no one in this field would ever recommend that. Instead, what we're suggesting is these are very cost-effective tools that are ideally designed to complement other approaches you might take to problem solving. In a paper that I got to collaborate on almost a decade ago now with Shlomo Benartzi and Cass Sunstein, Richard Thaler, John Bashir of Harvard Business School, and a large team of others, we started analyzing all of the interventions that had been tested and published in top journals that were targeting different policy relevant outcomes. And specifically, we focused on retirement savings, college enrollment, encouraging flu vaccination, and also encouraging energy conservation. I'm just showing you a portion of the graphs. I'll show you more in a moment. And what we looked at was for all of the published papers that targeted these, both with economic interventions or traditional interventions and nudges or behavioral science interventions, what's the cost effectiveness of the tool that was deployed? So we can measure its benefit, and we could also measure its cost and say, you know, for per dollar spent or per $1,000 spent, what is the return you're getting on that investment, essentially? And what we see is that nudges are incredibly cost effective, while often they have fairly small impact, as I just showed you on that last slide. The cost effectiveness is extraordinary. And so to not include this as a tool in your toolkit to complement other approaches would really be a mistake given how low cost they are. So these are a couple of examples. You can see those nudges really outperforming others. And then when we turn to looking at energy conservation and influenza vaccination interventions, we see very similar patterns, just generally across the board, extremely highly cost effective tools. Okay. But this raises a question. Hopefully I've convinced you now, okay, behavioral science insights can generate a lot of wins, even when we don't necessarily have the most powerful tools at our disposal and we're constrained by organizational, what's feasible. We still see on average that deploying these kinds of insights in communications leads to reliable benefits. We see it's highly cost effective. We want to use this to complement economic insights. But how can we efficiently assess which is going to be the most useful? Normally, what we want to do, the gold standard in our field, is to actually run a randomized controlled trial, randomly assign some people to condition A, some to condition B, A/B test. Did this new message, for instance, that we were testing, did it actually increase flu vaccinations? Did it actually increase savings? Did it actually lead to more tax payments? Those are costly to run, and they tend to lead to insights one at a time. And so my team at the Behavior Change for Good initiative at the University of Pennsylvania has been trying to encourage and promote and also run a new type of scientific experiment that we call a mega study. And the goal of this, it has a little bit larger fixed cost, but not much than a traditional field experiment. But instead of testing one idea at a time, we pool insights from many different teams of practitioners, of scientists, all of whom have ideas about how to make progress on an important target behavior with behavioral insights, and we'll test them all at once. And that means we can make apples to apples comparisons. You know, how does a planning prompt compare to a default, compare to making a goal bite size? Which of these things will be most impactful in the context we're embedded in for creating the positive change that we hope to generate? So we run these experiments, and we've at this point been running them now for almost a decade. We've looked at everything from physical activity to savings outcomes to vaccination to student outcomes. And we're seeing a growth of use of these mega studies, these massive collaborative pooled experiments that test many ideas at once for many different teams. They've now been used to tackle environmental problems by other teams. There's a mega study in development focusing on organizational culture, one on happiness, and there's one on polarization. These are being run by teams around the globe, not just at our research institution. And so we're really excited to see this growth. But to give you a little taste of what I mean by a mega study, I want to actually show you two that we've conducted. I'll focus on our work on vaccination. It's still pretty timely with the pandemic, a little bit in the rearview mirror, but still very much present in memory, to talk a bit about some of the work we did to try to understand what would be the most effective way to communicate about COVID vaccines with the general population. And we focus, most of our work on this that I'm going to talk about today was done in the United States, but we have also done some work overseas, and others have done work overseas with pretty similar types of findings, which is exciting, although there are certainly some differences, and I'm happy to talk a bit more about that in the Q&A. So the study I want to mention was one of two mega studies we ran in the fall of 2020. I talked about this at a previous behavioral science week for the UN, so I'll go through this fairly briefly, but just wanted to mention it before talking about a little bit more recent work as an example of an early mega study we ran in partnership with Walmart pharmacies to see if we could encourage more of their customers and patients to get a flu vaccine Now it's fall of 2020 and all the scientists participating. The goal was actually to be ready with optimal messaging to target COVID vaccination. But we wanted to test on a real outcome, because we know if we just survey people and say, which of these messages would work best to convince you to get a COVID vaccine? People will say one thing and it won't reflect what they'll actually do. There's lots of great evidence at this point that those kinds of surveys can lead us astray. So we wanted real ground truth in measuring actual vaccine decisions, and felt that the flu vaccine was a decent enough proxy for getting a COVID vaccine that it would be informative. So we ended up, we solicited ideas from a team of about 150 scientists, got 75 submissions, winnowed it down in this particular test to about 23 different ideas tested, and they really ranged quite a lot in the principles they employed, from asking people to make a commitment, telling them to do it to protect friends and family, telling them that ever more Americans are getting flu vaccines, so highlighting that this is a norm, telling people that a shot is waiting for you, suggesting it's already been set aside and sort of you own it, and using that ownership language, which we know from past research can be powerful, because we feel that we value things more that we feel belong to us. They also feel more recommended. So we looked at what happened here, and as you can see on the x-axis, we're looking at how many extra patients got vaccinated compared to a control group that didn't receive these behaviorally informed messages and reminders. In our baseline condition, where people weren't receiving these reminders, we saw 29.4% came out and got vaccinated within 30 days, whereas on average, we saw a multiple percentage point increase in vaccination just from sending reminders. And we do see variation in the performance of those reminders as well, substantial variation. It's not just sort of noise. So the best performer in this particular trial was telling people that a flu shot is waiting for you at Walmart. It was a very simple message highlighting that this already is set aside. And actually, I believe 3 of the top 4 performing messages used that same ownership language and the rest did not. There were a number of other things that worked well as in addition, but that sort of rose to the top. And interestingly, at a parallel mega study we ran in doctors' offices, we used slight variant on the language waiting for you. We were able to say it's reserved for you. And in that mega study, the reserved for you language outperformed everything else. And 3 of the top performers in a 20 a test of 20 communication strategies used that language. So we saw a lot of sort of confirmation for this particular communication strategy. The other thing I want to highlight was that multiple messages were more effective than a single message. So we learned, repeatedly reminding people is really worth a lot. Excitingly, other teams then turned around and proved, as soon as COVID-19 vaccines rolled out, that messaging people using this kind of ownership language was more effective than using other reminder messages. So this was replicated and extended both in the general population and healthcare workers. And another exciting thing that came out of this is that the team that led the development and deployment of that reserve for you messaging did follow-up research. And this is led by John Bogard at Washington University at St. Louis, showing that that kind of reserve for you language not only affects vaccine intentions and follow-through, but can be used to encourage lots of other positive behavior change. So they ran tests showing that if you tell people a conference slot is reserved for you, that increases attendance at the conference. If you tell people a book on Kindle has been reserved for you, it increases download. So one of the mechanisms of that seems to be implied selectivity, as well as this greater value we have for things that we feel we already own. So it was exciting to see that those mega studies not only answered a research question we cared about, but also generated a new behavioral science insight that could be deployed more widely to solve problems. So the last mega study I want to mention is a fresher one. Actually, this is not quite published, but it was just accepted and will come out in Nature later this summer. We wanted to explore whether or not free rides, offering people free round trip rides to COVID vaccine sites, and specifically we partnered here with CVS pharmacies, would increase follow through on getting COVID vaccinations. And while we were at it, we thought, let's do a mega study and also test some new messaging and see if we can improve on that simple ownership language message we proved so effective to encourage follow through on vaccines. So we ran this study in the fall of 2022. It involved 3.6 million pharmacy patients, and we tested 8 different messaging strategies, as well as free rides to and from vaccinations in partnership with Lyft. We tested the simple language that a booster shot is waiting for you. We let people know in one condition that a free ride to and from the pharmacy had been reserved for their booster appointment, and made it really easy to claim this. People just clicked a button or clicked in the link, and if they already had the Lyft app downloaded, it took care of everything else. The next time they went to a CVS pharmacy, the round trip would be taken care of. If they didn't already have the app, it took them to download it. It provided a code. So this was very similar actually to when the White House provided free rides in the summer of 2021 to vaccine appointments via Uber and Lyft, although we actually implemented this in an even more seamless way for customers. And we also tested some other messaging strategies that hadn't been tested before, as I said, to see if we could improve on what had been deployed previously. So we're very excited about seeing the data. How will this work out? There was some evidence recently from Sierra Leone, for instance, that mobile vaccination clinics dramatically improved vaccination rates by bringing vaccines to people so that we could overcome transportation hurdles. And we thought maybe if we could take people to the vaccines seamlessly, that would have a similar benefit. Okay, so first thing I want to highlight is that behaviorally informed reminders that we tested here, they worked again. So if you look at all of the triangles, they're all to the right of our baseline vaccination rate. You can see that vaccination was pretty low during the 30-day period in November of 2022. So only about 5% of people messaged went in naturally to go and get a vaccine. And so we were able to increase the vaccination rate by about 20% or 1.2 percentage points in our best performing arm. But what I want to highlight most about this intervention was the big surprise, which is that actually telling people a free ride to and from the pharmacy has been reserved for you for your booster, and providing that easily accessible free ride in a manner very similar to the White House deployment in the summer of 2021 had no benefit whatsoever over and above simply sending behaviorally informed reminders. This was a big surprise. When we looked at the predictions of experts and lay people, they consistently predicted that this would be the top performer and by a wide margin of all of the messages tested. And frankly, we did too. We were very bullish about this. That's why we invested time and effort in this randomized controlled trial. But I think this finding in some ways is the most important kind of finding, where there's a costly approach you can take to solving a problem and you determine it's not actually evidence-based, it's not improving outcomes. So we were very disappointed and pleased all at the same time. Disappointed because we hoped this would be more effective than it was, but pleased to know that this was not a good investment of resources when we were thinking about how do we encourage COVID booster uptake. One thing I do want to highlight that was a more positive result from this study is that we did find sort of a new winning message that outperformed our previous best performer. And it was a blend of something I mentioned before, two tools I've mentioned before, actually. It's a blend of prompting people to make a plan and using defaults all at once. And this was led by my amazing PhD student, Rob Kwan. We told people many find it helps to make a plan. And we invited them. We said, would Tuesday at 2 p.m. at 1 Main Street work? This is not an arbitrary default here, actually. It is a time that was selected based on when you had previously come to this pharmacy last for a vaccine of any type. That date and time was piped in and the location as well. And what we found is even though we aren't actually scheduling an appointment for you, you still have to go through exactly the same process. That time might not even be available. Many don't even choose that time. By providing a default plan, we seem to be making it a bit more seamless for people to follow through. We did a follow-up experiment to make sure that this really outperformed inviting people to self-set plans as we'd done in previous research. This was a follow-up experiment in the fall of 2023 with flu shots. We sent reminders to hundreds of thousands of patients, and we either said many find it helps to make a plan, what day of the week, time, and pharmacy location would work, or we said many find it helps to make a plan, would, and then we offered a specific time work. And again, either way, they still have to go through exactly the same process to find an available slot after this and accept it. And most don't go at the default suggested time, may not even be available. But what we see here is a significant, although pretty small, but significant boost in vaccinations when we use that default plan as opposed to inviting people to self-generate a plan, which suggests that it's not the act of thinking through and developing your own plan necessarily that's most important about a planning prompt, that when we can make it even easier to think through a plan and just end up with a plan by providing a default plan, that can be beneficial. Okay, so I'm nearing the end. I have sort of one more thing I want to share, but I wanted to do a sort of conclusion or wrap so far, because I hope what you have seen from at this point in this presentation is that behavioral insights really can help address pressing policy challenges, and they have big opportunity here to complement economic insights as a tool for encouraging behavior change at very low cost. So the cost effectiveness is a major takeaway from this research. While the absolute benefits are not often large, the cost effectiveness is extraordinary. And it's really like leaving money on the table to not try to use these tools to complement more traditional approaches to encouraging positive change. Hopefully, I've also convinced you that using these mega studies or sort of larger than usual randomized controlled trials where we test many ideas at once, pool insights from teams of scientists can be quite useful for identifying the best behavioral insights and economic insights that we can use to solve policy problems. And not only that, but they can generate new generalizable behavioral insights, as we saw in these two examples I just shared. One taught us about the power of ownership language to promote adoption of many positive behaviors. And also that planning prompts with default plans can spur follow through in a wide range of contexts. So not only can mega studies help us identify which of a set of options is most powerful, they can often identify new behavioral insights that we can port and use in many domains. So the last thing I want to mention very briefly is an exciting new frontier in behavioral insights and behavioral science, which is to combine behavioral science insights with machine learning and to put these two powerful tools together, and we can see that they create often more than the sum of their parts. I wanted to highlight a paper that I had the good fortune to be a part of that was published last year, led by Anastasia Bulyavskaya and Hung Ho, as well as Colin Kammerer. I was really more of a hanger-on, but it was a great adventure. And what we did is we tried to use machine learning to better understand the process through which habits are formed. And it was more of a descriptive project than a prescriptive project, just to understand some basics by using machine learning to model what does it look like for a habit to become stable. And we did this with two large data sets. One involved looking at the gym attendance of tens of thousands of people with over 12 million observations of gym attendance. The other involved hospital caregivers and their hand washing decisions as they entered and exited patients' rooms. And we had over 40 million observations in that data set. And we're basically trying to understand what is the process through which habits in these two domains become stable. Just to give you kind of a sense of what the modeling looked like, and this is with different deciles of data, but we're essentially fitting a curve to try to understand how quickly habits stabilize using machine learning tools to do so, and to try to estimate then what is for each individual sort of the time to habit formation, the time to predictability of their behaviors around gym attendance or hand washing. And there's a couple of key takeaways we have from the work we were able to do to understand what the process of habit formation looks like. First, we see really wide variability in habit formation speed, both across these domains and across individuals. But importantly, across these domains, we see that it takes months, on order of magnitude months on average, to form gym habits, but weeks to form hand washing habits. And this really contradicts a sort of a standard assumption that's out there, largely in the sort of popular press, that there's a magic number of days it takes to form a habit. We see it really depends on the context. How frequently are you repeating the behavior? How complex is the behavior? These things almost certainly contribute, but we now have this really strong estimate that wide variation in speed of habit formation across individuals and pretty sizable differences in very different contexts. So we think that's an important thing to sort of debunk the magic number theory that had been out there. The other thing we were able to do that I think is pretty exciting is we were able to demonstrate something that we believed was true from animal models, but hadn't been able to see in the field before, which is that there's reward desensitization among those who form habits. What do I mean by that? Well, what that means is once you formed a habit, it's harder to disrupt your behavior by trying to offer you various rewards to change your activity level, for instance. And here we were able to look at gym goers who our models showed were more predictable or habitual, and look at how they responded when offered incentive interventions designed to get them to go to the gym more. And we saw that the more habituated people were, the further they were in that sort of curve that we were modeling, the harder it was for these interventions to generate any benefit. And so that was another sort of exciting use of machine learning to figure out we could differentiate between types of people and how they would respond to interventions. So looking forward, I hope that I've convinced you that mega studies hold great promise, but I also want to highlight that I think the combination of mega studies with machine learning tools holds great promise. And one of the new frontiers in thinking about how can we use behavioral science to create positive changes, to think about how can we uncover personalized approaches. So each individual will encounter, say, the intervention that's most tailored to their own needs and to the barriers that might hold them back when it comes to making a positive change. And by using personalized approaches developed with machine learning algorithms, which can be applied, for instance, to a mega study to see what works best for whom, not just what works best on average, we have a real opportunity here to improve outcomes. And of course, economic interventions can be used and economic insights alongside behavioral insights in that personalization process. So let me wrap up there. Just thank you all for listening. Thank you for being here. Thank you for your excitement about behavioral science. And thank you to the many, many collaborators on this work. Particularly, I want to highlight the funders of the Behavior Change for Good initiative, our staff, and our organizational partners that have made this work possible. And I will stop sharing now, and I'm really excited to take your questions.
Great. Thank you so much, Katy, for that. First of all, great introduction to what behavioral science is and getting us all on the same page, and then giving us a bit of a tour of what's been happening over the last decade plus when it comes to behavioral science and practice, and letting us know that about the small, measurable, reliable, but as well as cost-effective applications of behavioral science. Also, tour of mega studies. I mean, this is Katy said it's frontier. It's really, just to maybe contextualize this a bit, Katy's one of the leading researchers in the world in this space. So it's really amazing to get an insight into how these mega studies are applied. And then also on habit formation and what we could potentially do in the future with machine learning as well, which is quite exciting. All right, so we have a lot of questions coming in. I'll try to summarize a few of them. So the first one here, which got a lot of votes, but it was at the kind of the start of your talk, Katy, and it looks at how can behavioral economics or behavioral science be most effective in rural communities? So I think maybe we can extrapolate this to mean more subpopulations, thinking about specific people. You spoke about mega studies and also variability in some of the people and some of the but maybe just unpacking that a bit, how you explore the more personalized components within mega studies in your work more broadly. Over to you.
Yeah, no, it's a great question. So I think there's a number of different ways to think about this. So personalization can mean multiple different things, right? So first of all, we want to tailor to the context. So if we were running a mega study in a major US city versus a rural African region, we would think differently about what are the barriers, what are the behavioral barriers that might exist to, say, getting a vaccine or whatever behavior it is that we're targeting. But let's think about vaccine intentions. In fact, I think I mentioned we saw that there was really no benefit of these free rides that we provided in US largely urban centers and also their surrounding rural areas, but there have been huge benefits shown of creating sort of reduced transportation burdens in Sierra Leone. So those are really different contexts, and we have to think differently about what is the barrier that is standing between someone and their and the outcome. And in the US, what we identified in our mega study was, well, the barrier wasn't transportation, at least to the extent we expected it was for a large swath of people, whereas in Sierra Leone, it probably was. And understanding that we're gonna need to generate insights specific to the population where we want to target, and that we can't port those insights necessarily without running a different test is really important. You can also start thinking about, maybe there are subpopulations for whom the answer is different. Even in the United States, right? There's huge variation in who lives in rural versus urban settings, who has access to public transportation and who doesn't. In that particular study that I shared, we did a lot of digging to see if there were subpopulations for whom there were benefits. And I will say it was shocking to me to find that there really were none. But that doesn't mean that there aren't any globally, right? And so that kind of sort of digging in and trying to figure out how can we understand what's the best intervention for women in California versus who are over 50 versus young men in Ghana. That's important work, and it's one of the things that a mega study is actually really well suited to do, because you're not just testing a single idea, and by testing, say, 20 ideas or 20 potential solutions to a problem, you're going to start being able to say, oh, this solution really worked for them. For this other subpopulation, the number one solution is different. And machine learning can help with that. So just because it has more powerful tools for zooming in on what is the optimal approach, as opposed to us poking about in the data and trying to figure it out.
Great, thank you for those insights. It really echoes a lot of the conversations we're having across the UN about why we're testing in general when it comes to behavioral science, really just knowing what works. But also maybe to highlight some work from UNDP in Armenia. They did a study, not a mega study, a large one with 20,000 people, and looked at cervical cancer screening uptakes. They did like the famous study that's been done numerous times over. What they found was it worked. Well, obviously it worked, not surprisingly, but what they found was an interesting actually rural-urban divide, which led to some interesting policy recommendations in terms of how they would send those letters and to whom and to target. So it's a good question about, what do you do? What do you find? But then also the real policy implications afterwards about, the cost effectiveness, but the scarce resources, particularly in some of these countries, and how we can best use them to send letters to the right people or, along this as well. So enough about me and then the UN, more over to you, Katy. Some more questions for you. So there are a few questions about, you mentioned the default with savings behavior, that foundational study a number of years ago. There's some questions around defaults in general, particularly when it comes to defaults and organ donation. So some of the implications around that and to what extent, the default is maybe helping people make a choice they want to make or perhaps not. So maybe just unpack that a little bit, particularly defaults in general, but then also in the organ donation context. That would be great. Thanks.
Yeah, the organ donation context is a really important one because actually, while research has shown that countries that default people into being organ donors have higher organ donation rates in terms of signups, that in most cases there's legal challenges that make it not necessarily a lot better in terms of how many organs are eventually available for donation, because when the default is changed, it's not necessarily someone actually saying, oh, this is what I want. And so often their relatives will challenge the fact that someone is an organ donor if there's a default that seems to have been the reason they were an organ donor. So in practice, that actually is an example of, while the default has the intended effect on the initial decision, which is many more people agree to be a donor, the downstream consequence isn't necessarily what we all sort of hoped it would be, which is then there are more organs available. And there's complexity always in thinking about, is the decision that I am trying to shift, will it have the outcome that I care about? There's some similar research in the savings domain actually showing that often, even if we can default people into a savings plan, maybe we'll default them at a low rate and it's not sufficient to lead them to save a sufficient nest egg for retirement. Also, often there's leakage when people move between employers, they'll take money out. And so maybe even though we got them saving, they weren't saving at a very high rate, and then it comes out. So defaults are not to blame for these limitations, but it highlights just the importance when we're in any of these settings of understanding, is the default you're creating going to change a decision that has the implications you want it to have? Another example of defaults being sort of successful is in vaccination. When we default people and tell them, this is work by Gretchen Chapman at Carnegie Mellon, when she defaulted people into having a flu vaccine appointment at a campus center, it dramatically increased the number of people who got flu vaccinations. She said, here's your appointment, here's your date and time, you're all scheduled, come on in. It dramatically increased the number of people who got vaccinated, but it also led to an enormous number of no-shows and organizational costs associated with that, because lots of the people given a default appointment ignored it because they hadn't actively made that appointment. So there's these costs and benefits, and recognizing, are you targeting the outcome that will really benefit people and that has the long-term consequences? That's a critical part of using defaults. But the tool itself is pretty reliable and robust in terms of its benefit. You just have to target properly.
Exactly. It underscores your point earlier about context being so important and looking at how, not just the tool, but how you're applying it, where, to whom, and all of those considerations. All right. Okay. So now a bit of a simple, straightforward question for you, Katy. Talked about behavioral science. What are the long-term effects of behavioral science? So you talked about some of these actions, going to get a vaccination or going to the gym, maybe repeatedly, but what are the long-term implications? And then potentially are there unintended consequences associated with long-term implications as well? Maybe just unpacking those general comments about behavioral science overall.
Yeah, it's a great question. First of all, I want to say one of the reasons that I co-founded the Behavior Change for Good initiative with Angela Duckworth is we were both frustrated by the lack of evidence on long-term outcomes of behavioral interventions. Most are sort of short-term one-shot interventions. And for those, we can look at the long-term implications and say, oh yeah, there's still, the vaccine they got still in their body forever. So there's a good long-term influence of getting someone to get a vaccine, but it's not quite the same as, do we change someone's mind about something? Do we change their daily behaviors and their daily decisions? Can we use behavioral science repeatedly to generate benefits? One of my favorite studies that was done on the question of sort of what are the durable benefits of behavioral science interventions was done by Hunt Alcott and Todd Rogers. And it was using data from an organization called OPower that's now a global organization that was started in the United States. And they send energy communications from your electricity company to your home and let you know how much energy you're using, but also how you compare to your neighbors. And they send these on a monthly basis, and they do it for years and years on end. And they've run large randomized controlled trials where people receive these messages for years and years on end, and others are randomly assigned to a control and don't. And what they find is very stable and robust benefits over time of continuation of sending these reminders. Again, order of magnitudes, like a 2% reduction in energy use at almost zero cost. So very cost effective. Is it going to solve the climate crisis? It is not, but it's a nice low cost complement to other tools. And in fact, what they also found is that if you end these communications, you stop sending them after someone's received them for a couple of years that have these behavioral insights embedded, you actually continue to get about half the benefit. Most of that was because people had made changes to their situation as a result of the messaging. So for instance, they put in LED light bulbs and they'd replace their refrigerator with a more energy efficient one because they were getting these communications that motivated change. And then when the communications end, they still have those new appliances that are reducing their energy use, but probably their own behaviors fall back a little bit. They're like maybe a little bit less attentive to turning out the lights, for instance, or turning the thermostat to a more reasonable temperature when they're out of the home. So that's my favorite study that looks at these long-term implications. There's other research too. In general, we do know that repeated rewards can and behaviorally informed incentives can lead to habit formation. And so there can be some durable benefits even when interventions are removed. But my main takeaway is that the best way to use behavioral science insights to create long-term change is actually to continue to deliver interventions over time, as opposed to thinking them as a sort of stopgap or a short-term solution. To the extent that you're trying to change a behavior consistently over time, you want to keep using that messaging. And we don't see a lot of reactance against this or irritation generally in the literature where people wish this would be taken away. When we message people, for instance, reminding them to use their volunteers on crisis text line and to go back, and we say, it's 4 hours every week. They don't get annoyed with us. They like receiving the reminders, right? They're glad to have it. People seem to like these messages from OPower, letting them know how they compare to their neighbors. To the extent that the behavioral science intervention is one that complements a person's own goals, that repeated interaction can be something that's very desirable to everyone and that creates sustained change.
Great, thanks for that, Katy. And it again underscores some of the conversations we've been having in the UN about the ethics of behavioral science, and it's about helping people follow through with their own intended actions and behaviors. And we haven't gone into this here talk, but there's a lot of thinking that goes into that and really helping people make the decisions that they ultimately want to make. Okay, so lots of questions coming. I'll try to group a few of them. So one question for you, you've mentioned a few areas where you've run mega studies, but thinking about maybe your next or your ideal or dream space to run a mega study, particularly maybe in the realm of the UN. So something related to the big challenges, pressing challenges today, the Sustainable Development Goals. What are some of the biggest challenges? Where would you like to run a mega study and kind of those issues? Where do you see potential? And then also there's a comment here, it said it'd be super cool to run a mega study on organizational culture within the UN. If you're curious to unpack that a little bit about how you might think about a mega study within an organization. So any bigger, broader policy or programming areas, then also within organizations is what might we consider what they are in terms of mega studies.
Yeah, those are great questions. Well, I should say that as I was sort of shouting out to lots of mega studies that were gearing up, I was talking about other teams. In fact, the organizational culture mega study is not one that I am involved in, though I've tried to offer advice and tips on how to do it using best practices that we have learned over the years. But that's being led by a team at UC Berkeley, Jenny Chapman at the lead of that. And I'm sure she'd be very excited to talk to the folks at the UN about your participation. my dream is one that I'm trying to make a reality. We're very deep in launching a mega study on student success. So I think this is a really important target. Education is sort of the key to all positive outcomes globally, as far as I can tell. Doesn't seem like there's any better investment we found. Health and education, they're magic. Or not quite magic, but they feel like magic. The results are so extraordinary. So we are doing some work on whether or not we can create programming that encourages more persistence in the educational system, that gives people a sense of belonging in environments where they might not otherwise feel belonged, that gives them some of the skills they might need, from understanding sort of how to plan and schedule themselves, to even some mental health tools they might need, paying them to meditate regularly to try to improve mindfulness and improve their mental health. So we're testing a wide range of interventions there, and I'm really excited about that work on student success. I think its potential is huge. And it seems like the kind of thing that would be very, interesting. And we're doing it with US college student populations, at schools where there's very high attrition rate, which is very costly because there's a lot of debt taken on. But you could imagine global interventions targeting all different populations that are focused on encouraging student success and persistence. So I think that would be very related to the UN's development goals.
Great, thank you for that, Katie. Colleagues working in education, space to explore in the future. Okay, so now kind of related to that point a little bit about thinking about mega studies, and obviously it's a lot of effort, a lot of time, and a lot of collaboration that goes into this. So for colleagues thinking, reflecting upon doing maybe a pilot or an online experiment or an RCT, randomized control trial, or a mega study, how do you secure funding for these interventions, and what might be some criteria as to when to do a mega study or when to do a more, let's say, more less advanced kind of methodological approach to the application of behavioral science? So what criteria do you have to run a mega study versus not?
Yeah, that's a great question. Normally, it's not you don't want your first foray into a problem to be a mega study, right? If you've never studied this topic before, you've never run an A/B test in this zone, don't start with a mega study. Start with you can call it a pilot, test one idea and see if you can get traction on changing this behavior using behavioral insights. It's really more the mega study comes in when we have a mature problem or a really, really pressing and important challenge, that we feel ready to start comparing many different competing solutions to. So I think the COVID pandemic and the challenge of vaccine hesitancy was a natural candidate for a mega study because we very quickly and very urgently needed solutions. And we already knew a lot about how much behavioral science could do for changing vaccine take up and follow through, because there was plenty of past research on that. So we had a sort of mature problem and a pressing policy need, and we wanted to know what was the most cost effective and beneficial strategy to deploy at scale. It's a perfect candidate for a mega study. And I think there are many such challenges. There's many pressing global problems. There's many candidates for mega studies. We could learn so much more, as I said, about student success, about happiness, about medication adherence, savings, budgeting. There's a lot of things that matter. Energy conservation, and there are mega studies that are underway on many of these challenges, which is really exciting. But there's need for more. And I would say in terms of funding, we have had a mix of funding approaches. One is to look to nonprofits that are funders for grants, right? The sort of traditional way that research gets funded. You go to try to get a grant, whether it's from a government or a non-governmental organization that funds work that they feel has important impact. We have also, though, had some success partnering with organizations where there's an alignment between their sort of profits and what's good for the world. And when you can partner with a large organization at scale, if they see that there's a benefit to their bottom line and you see that there's a benefit to your goals, but you can bring new science and new insights, that can be a good recipe for creating a mega study. So that's also been an approach we've taken, is to see organizations fund the work. So those are two approaches. But I also want to just say mega study doesn't have to be extraordinarily expensive. To the extent that you're doing something digitally or in a space where you're already going to be, say, communicating with people, it's more about the scale and making sure that you have a massive scale and the ability to conduct A/B tests. But if you can do an ABC test, why can't you do an ABC to Z test? It's really a question of, do you have the population size? And the complexity of collecting different intervention ideas and so on is not that extraordinary compared to many of the other things needed to do an A/B test in the first place.
Great, thanks for unpacking that a little bit further for colleagues. Okay, so there's also a question here regarding different countries. I know you alluded to differences in, say, Sierra Leone and the US, but this question is, well, to what extent are things different, which I think you've already answered, but maybe kind of building upon your mega study work, we work across the world in the UN, and oftentimes we get asked to quote scale up, something different countries. But we also acknowledge that, obviously, as you mentioned, context is very different. We can't always just take the results from one country and directly import them to another. So to what extent is there merit to value to maybe doing multi-country mega studies or leveraging the expertise and the data that we have in the UN working around the world? What make you say for us kind of working in the UN and the different areas that we work?
I think there's enormous potential there, and I know that there are some teams that are starting to scale up, doing multi-country mega study work. Particularly, there's a happiness project underway that will be global, and I think that's so important because we know that the barriers, to my perspective on behavioral science, is that the best behavioral science, and this is sort of the premise of my book, How to Change, the best behavioral science solutions meet people where the barriers prevent change. So if the reason that you aren't taking your medications is because you hate the side effects, we're going to need to provide a really different intervention than if the reason you're not taking your medications is because you keep forgetting, right? Those are totally different barriers, and people globally face different barriers to the challenge of education, the challenge of vaccination, to the challenge of energy conservation, and so on. And so we need to test many ideas and meet them where they are. And that kind of work is tremendously important to do. And machine learning, as I mentioned, I think is an excellent complement to doing that kind of mega study, because it allows you to hone in on, okay, what were the key characteristics that are differentiators? And I will say that in general, when I use my intuition to predict what will happen in these mega studies and what subpopulations will respond to what, I'm not great at doing it. Maybe that's another key finding in behavioral science, is we're not good intuitive statisticians. We're not good intuitive many things. We're limited. And so really using evidence and science to figure that out, figure out the personalization is an important thing to do.
In the last few minutes here, we've had a few questions come in, just wanting to more generally unpack a bit more about machine learning and behavioral science overall. So you gave your case study, you've spoken about the potential in the future, maybe just a few more insights there about any reflections we can take forward in that space.
Oh, that's a good question. Well, so first of all, I should say, I am a dabbler, or the people I would read, to the extent that you're excited about this, Susan Athey at Stanford, Sendhil Mullainathan at UChicago, who's about to move to MIT, Colin Kammerer at Caltech. Those are the people who I look to for sort of cutting edge insights about how can we use machine learning best to inform the deployment of behavioral science insights. And I encourage you to take a look at all of their work. But one thing that I will say is, in our mega studies so far, we've been a little bit disappointed when we have applied machine learning in trying to figure out what works best for whom. Some of the benefits have been smaller than I expected. And I think one of the key learnings I've had from that is actually we haven't varied the tools we're using nearly enough, I think, to maximize the benefits of what machine learning has to offer. If you do a mega study and everything you're testing is just a different text message, communication strategy that's reminding people, they're kind of all tackling the same behavioral barrier. Whereas if you're able to test a wider range of approaches to changing behavior, ranging from social support to reminders to changing defaults, providing structural support, providing transportation, when we could tackle different barriers, I think the potential is going to be much larger for that personalization and tailoring than what we've seen in our more limited case studies to date. And so I'm really excited for that frontier that I think we're all pushing, a sort of machine learning meeting more widely varied intervention deployment to help us understand what personalization looks like optimally.
Great, thank you for that, Katy. We'll explore the academics. We actually had Susan Athey speak at an event last year on AI and behavioral science. So we can also share the link to that session. Great remarks and examples there. So thank you so much, Katy. I think we're at time. Do you have anything else you wanted to add at the end of this session, or are you
Just thank you
But
for having me. It's been a pleasure. I really appreciate all the great conversations and the important work you're all doing to try to make the world a better place. And I hope behavioral science will be another tool in your toolkit that that you can deploy to that end.
Great. Thank you so much, Katy, for joining us. And just to say, we will share the recording of this webinar on our YouTube playlist. And as mentioned, there are still many events throughout the week to attend over the next 3 days. So looking forward to seeing you there. Thank you so much, Katy, and looking forward to continuing collaboration. Okay.
Thank you.
Bye, everyone.